So I'm going to share a little bit about how I ended up in this specialty profession. Before becoming an orofacial myologist, I struggled for years to get help from my daughter's resting posture, aka tongue thrust, that I diagnosed at 2 years of age. Her teeth were such a mess at 7, but it was so hard to find treatment for her other than braces. Unfortunately, I knew braces were only going to treat the symptom of the larger problem, which was where her tongue was resting. So you can see in this picture what the OMD did to the development of her face. This is something I wasn't aware of until I had my training, and it's why I'm sharing this information here. It took 5 years of braces, a Herbst appliance, and myofunctional therapy to correct the damage that was done by her tongue not resting on the palate. My goal is to educate parents on how to treat these conditions early so the damage to the teeth and the face is avoided, or at least minimized. Needing braces, which seems to be a rite of passage anymore, is not normal, and in many cases can be traced back to some type of undetected OMD. Without treating the underlying problem, the teeth will move again when the braces are removed, because barely anybody will wear their retainers for life. So how do you know if your tongue is resting properly? Some common signs of a tongue that is not resting properly include upper teeth push out of alignment and further forward than the lower teeth, which is called an overjet. An overjet where the teeth are together that has the same shape as the tongue, maybe a small O. Messy teeth or food falling from the front of the mouth. Taking large bites of food and swallowing without chewing. Chewing on just one side of the mouth. Excessive need to drink during meals. Noisy swallowing and eating. Difficulty swallowing pills or requiring the pill to be placed far back into the mouth. Lips are often open or apart. Mouth breathing. The tongue is always visible. Tooth pain after waking due to pressure of the tongue on the teeth at night. Jaw pain and clenching or grinding. Snoring and sleep apnea. How can I find out if there's a problem? You can do a simple swallow test to determine if you should seek out orofacial myologist or myofunctional therapist. What you're going to do is just get a cup with some water, hold a sip of water in your mouth. You're going to smile, keep the lips open while keeping the teeth together, and then you're going to swallow the water. Those with abnormal tongue resting posture will typically have one or more of the following characteristics. The tongue will come forward and make contact with the front teeth, or the water will spill out from the front of the mouth. The head will be thrown back to initiate the swallow, or they just won't be able to swallow without being able to close the lips, or they will say they can't do it.